Is everybody more or less seated? Good. While all of you get seated, let me just tell you that I got word that through social media that the two-day call to action is being discussed in 135 different nations, including the Prime Minister of India. So again, as I said yesterday, we are not alone in this room. I want to be very, very brief. I inherited from the previous moderator a sign that said, "You are overtime." And I would note for all of us that we're already over time as we are moving along. So I will be very brief and not stand on protocol. We will be discussing, my colleagues will, the newly formed, as of late March, Commission on Life-Saving Commodities. This is extremely relevant. Everything I heard this morning in talking about, as many spoke so extremely interestingly, about the major killers of children, diarrhea, pneumonia, and especially the very welcome focus on maternal and especially neonatal deaths, are very much related to the work of this new commission, which will be, it was announced in March. It's had one face-to-face meeting, one more or less virtual meeting of the commission, is hard at work on a number of recommendations revolving around the importance of shaping markets, rather along the lines of Gavi, on life-saving commodities, on dealing with regulatory regimes, and very much on helping to create and support demand for these life-saving commodities, because often, even though they are very expensive, they are way underused. And we're very fortunate to have on the panel Tori Godal, the Senior Advisor to the Prime Minister of Norway. And I might note that the commission is being chaired by the President of Nigeria and the Prime Minister of Norway, and vice-chaired by UNFPA and Babatunde, my friend Babatunde, and I, and very importantly, has a very strong representation from civil society and the private sector in its work. In addition to Tore, we're very happy that Dr. Pate, the Minister of Health of Nigeria, is with us. Mrs. Bangura, who is a member of the Commission also, the Minister of Health of Sierra Leone, and Babatunde, the Executive Director of UNFPA. Before we begin, we have a very short video on the work of the Commission. If you can, that's a cue. The video is not working. The Commission is working. The video is not working. And we may play it at the end if we have time. So let me begin with Tori Godal, who's, I think it's fair to say, has been the person who most inspired the beginning of the Commission. So, Tori, do you want to come up and speak?
Thank you very much. It's a great pleasure for me to be here and to contribute to this important event. Tony asked me to say something about why a commission. And we took the lead from the Accountability Commission that in less than 1 year basically had developed its report with its recommendations and implementation plan that was financed from January until September, when it was handed over to the Secretary General, and it was led again by two heads of state government, President Kikwete from Tanzania and then Prime Minister Harper of Canada. So this is turned out to be an extraordinarily efficient mechanism to move very quickly and to get broad-based support. And I would just recognize the leadership of Flavia Bustreo and WHO in making it happen. Here, we have another area which is very neglected. And if you take vaccination today, almost 4 out of 5 children in the poorest countries in the world are getting at least 3 shots of vaccines. Here, we are talking about that perhaps 1 out of 4 women are giving delivery in a facility that have a regular supply of life-saving medicines on the shelf. This is, as the Prime Minister say, the most brutal expression of discrimination against women. And so it's a tremendous task then to take an end-to-end approach from production to really end user for 13 commodities that are life-saving and spans from family planning all the way to oral rehydration salts. So we are very excited. We will move in the same way. First recommendations, then having an implementation plan, and hopefully that will be financed by the time that we meet in September. Thank you.
And then if I could ask Minister Pate to speak.
Thank you, Mr. Lek. As was mentioned, our President, Dr. Goodluck Ebele Jonathan, is co-chair of this UN Commission, and I'm to speak on the potential impact of the work of the Commission for countries. We all know that the health-related MDGs focus on women and children. MDG 1 on nutrition, 4 on child health, 5 on maternal health, and 6 on the communicable diseases of malaria, TB, and HIV. We will not achieve these MDGs without enhancing our focus on those who are most vulnerable, the women and children, particularly in developing countries. In countries, this means increasing availability, the access, the affordability, and utilization of essential key commodities that will lead to saving the lives of mothers, women, and children in our respective countries, including the rational use. It also brings to the point the issue of equity. Not only are there wide inter-country differences in these lives lost, but there's significant intra-country variations in how lives are lost, and the access has to reflect that. And I think that has been a consistent theme of this conversation, but also, I believe, reflected in the work of the Commission. For us in Nigeria, the President is the co-chair of this Commission, but it also represents significant political commitment at the highest levels of our government around this issue, around making access to the most vulnerable populations of these basic commodities that save lives. We've developed a scale-up plan for essential commodities, focusing on pneumonia, diarrhea, and malaria. And it's a consolidation of an ongoing effort that we've been undertaking for improving community case management. I mentioned yesterday that we're also scaling up access to maternal and child health services using our subsidy reinvestment funds. We're expanding community health workers to rural health facilities all over our country. And they are the retail outlets for taking those commodities to where they are needed for the most vulnerable and the poorest segments of our population. In essence, if we are able to scale this up, we'll save hundreds of thousands, if not millions of lives over the long term. The diarrhea, antimalarials, and antibiotic scale-up, when fully scaled up, we've estimated will save about 221,000 lives of children by the end of 2013, and almost 500,000 lives by the end of 2015. Same thing with the long-lasting insecticide-treated nets. By 2010, it's been estimated that almost 178,000 lives have been saved of children. Imagine if we can scale it up twice what it is currently in our country. We've just introduced new vaccines, a pentavalent, and we're introducing pneumococcal vaccine in 2013 with the support of Gavi and several other partners who are here today. And we've also focused on community management of acute malnutrition. We've scaled it up within 2 years to where we have almost 140,000 children admitted and successfully treated in 60% of the cases by 2011. And so that's also an effort that is ongoing to contribute to saving the lives of our children. This is an example of what it means, the work of this commission means at the country level. So thank you very much.
I will make room for you. And now, if Minister Bangura would say a word on what this is going to mean for the women and children of Sierra Leone.
Thank you very much. I think the question that everybody keeps asking is, why the commission at this particular time? My answer is simple. Giving birth has become a time of anxiety and fear, pain and sadness to millions of women, families, and communities around the world, as opposed to being the joyous occasion and period of celebration that it ought to be. In many cases, there is a blink choice of whether the mother or the child could leave the delivery room alive. The majority of children who survive do not live to celebrate their 5th birthday. The death of so many women and children has not only resulted in a huge demographic problem, it has also had detrimental socioeconomic effects on the countries concerned. As we therefore get to the countdown to 2015, and as part of the global strategy for women and children's health, this diverse group of 20 men and women selected from all walks of life and across the world have been asked within the Every Woman and Every Child movement to work within a strict time frame to come out with a quick resolution that will make very quick impact on the lives of our women and children around the world. As part of the deliverables of this group, who are supported by a team of high-level technical men and women, they have firstly identified 13 life-saving commodities, which covers maternal, newborn, child, and reproductive health. Secondly, they have identified 3 cross-cutting barriers that must be addressed. These are regulatory challenges, market failures, and user supply and demand challenges. Thirdly, they have made recommendations in 10 strategic areas under 3 headings, which are 1, improve markets for life-saving commodities, improve national delivery of life-saving commodities, improve integration of private sector and consumer needs. All of this is to ensure that the 13 identified life-saving commodities can be manufactured, regulated, procured, and distributed easily and accessible by every woman and child around the world that needs it, from Washington to Moscow, Norway to India, Nigeria to Egypt, Mexico to Papua New Guinea. As a Minister of Health and Sanitation in Sierra Leone, I do believe that the recommendation of the Commission, if fully implemented and effectively monitored, will ensure that these 3 recommended essential life-saving commodities will, 1, reach young girls, mothers, and children, and will ensure free preventable health services as part of delivery, and will provide universal access to key essential health commodities for women and children. 2, it will ensure the effective implementation of my country's integrated management of neonatal and childhood illness. 3, ensure availability of life-saving commodities that my health facilities nationwide will require. 4, it will strengthen and sustain my country's free healthcare initiative, which has removed user fees and provided comprehensive healthcare services to all pregnant women, breastfeeding mothers, and children under 5. Finally, it will improve the neonatal health, family planning, and adolescents' health in Sierra Leone. What do I see as my current challenges as Minister of Health in reaching women and children that we need these life-saving commodities? 1, poor road network, infrastructure, and lack of equipment. 2, lack of trained healthcare professionals and general adequate human resource capacity. 3, inadequate storage facilities for drugs, vaccine, and health commodities. 4, weakness in procurement and supply chain management. 5, traditional and cultural practices. 6, limited monitoring capacity. And 7, poor diagnosis and referral system. All efforts are being made by us as a government, together with our partners who include the DFID, USAID, European Union, World Bank, African Development Bank, UNICEF, UNFPA, WHO, Global Fund, and Gavi, to help us address these challenges. And step by step, we are overcoming them to ensure that essential life-saving commodity for our women and children gets where they are most needed. and when they are most needed. I thank you.
Now, Babatunde, if you would like to, my fellow vice chair and friend, if you would like to say a word.
Thank you, Tony. Good afternoon, ladies and gentlemen. And it's always very difficult to follow the minister because I think she said everything. But I think we need to step back and look at what is happening to newborn and reproductive health. Suddenly, the stars are lining up to bring these issues together. I cannot remember in my career when we had back-to-back focus meetings that actually addressed these issues in such depth. About a few weeks ago, we were in New York at the commission, second meeting of the third meeting of the commission on commodities. Now we're here at Child Survival, and on the 11th of July, we'll be in London looking at family planning. I think that as a community, we should link all of this to be one. Because I believe that when we talk about service delivery and being able to reach that last mile, that last child, and that last woman who requires services, all of these actually do come together. People don't go to the clinics for just one service. They tend to go for different things. And if we can provide those different things as a one-stop shop service, we actually can have economies of scale. So I want us to take the advantage we have with all that is happening now, and the political will and the visibility that these issues are getting across the world, take advantage of it and let's run with it. It is also important, and I'm very happy that our colleagues from partner countries and countries that actually do benefit from these efforts are here today, and they are contributing. My colleague from Sierra Leone just spoke very eloquently about what it will mean to her for these commodities to be available. And I want to say that we should work with member states and countries, as we've talked about in the last 2 days, ensuring leadership at that level, ensuring that they have plans, ensuring that we can monitor, we can process, we can provide resources, making sure that we do not create systems that disempower them, and ensuring that we can report and show evidence to all of us, including our clients, including those who want our services. And I believe that that is the essence of this. Tony and I, as vice chair of the commission, we are committed to ensuring that we facilitate this in such a way that it adds value to the work that all of you do. So it is not seen as a separate entity, it is seen as a facilitatory process. So the commission, in looking at a fairly limited number of commodities, including oxytocin, including magnesium sulfate, including emergency contraception, would fold into the larger picture of family planning, for an example, and all the other things that we have to do to make children survive their first 24 hours of life. So it is a continuum of care thing, and we want to make sure that resources that are made available, not just money, but technologies and human resources actually speak to this and make a difference in the long run. Now, accountability is a major issue. We have to be accountable. Reporting has to be better. We have to make the money work better. We have to ensure that between domestic resources and ODA, they actually do achieve that which they are set out to accomplish. UNFPA And I'm sure UNICEF stand ready to work with you in given given life to this commission so that it can provide for you all that we want in the long term. I thank you for your audience.
Thank you very much, Babatunde. Thank you very much to all of you. I'll give them a little more time to get the video ready, if necessary. Let me just make 2 points. One is that the recommendations of the Commission will be completed by September and will be presented at around the time of the General Assembly. But secondly, a context. The Commission was formed out of frustration among all of us. Not frustration, anger among all of us that millions of children's, and I'm a former professor, children and women are dying because of a lack of access to the simplest life-saving commodities, antibiotics, the kinds of commodities that Babatunde was referring to. That coverage rates, correct me if I'm wrong, of the use of ORS, for example, which has been around for decades now, are still well under 50%. Antibiotics that would be so easy to deliver are not being delivered and not being used. That's a moral obscenity. But it is also a tremendous practical opportunity because this is a tremendous way of very cost-effectively reaching into the most disadvantaged communities around the world. So we're looking forward very much to finishing our work with the help of all of the commissioners that you see here. And we look forward then to its making a practical difference in all of your work as we go forward. Is the video ready? No, then I think we will. It is.
The UN Commission on Life-Saving Commodities for Women and Children convened in New York this week to finalize recommendations for urgent action to help women and children around the world. Launched by UN Secretary-General Ban Ki-moon in 2012 and co-chaired by Prime Minister Jens Stoltenberg of Norway and President Goodluck Jonathan of Nigeria, the Commission on Life-Saving Commodities for Women and Children seeks to improve access to affordable and effective medicines and health supplies for the world's most vulnerable people. According to UNICEF and UNFPA, which serve as the vice chairs of the Commission, every day nearly 800 women die from complications during pregnancy and childbirth. And every year, almost 1.4 million children die from pneumonia. The Commission's work focuses on 13 life-saving commodities, which all too often do not reach the women and children who need them most. Among these are common commodities like antibiotics to treat pneumonia, zinc and oral rehydration salts to treat diarrhea, and oxytocin to stop mothers bleeding after childbirth.
We know that it is actually easy to reduce the number of deaths because by providing more medicines, which we already have, to more people, we can save the lives of millions of children and women all over the world.
During the Commission's session, UN Secretary-General Ban Ki-moon reminded the commissioners of the grim realities they are faced with.
Every day, 800 women and more than 20,000 children die from preventable causes. Every 2 minutes, a woman dies at what should have been a joyful moment. And millions of women are unable to choose if, when, and how many children they should have because they lack to modern ways of contraception. This tells me we are still not doing enough.
UNICEF Executive Director Anthony Lake, who also serves as Vice Chair of the Commission, makes it clear.
This is an opportunity we cannot waste. We must find new ways of overcoming persistent barriers. New ways of putting more life-saving interventions in the hands of more health workers to reach the women and the children in greatest need.
To that end, the Commission has been focusing on the three main areas of market shaping, regulatory environment, and best practices and innovation to help shape the best way forward.
We have these very simple, highly effective products that cost, in many cases, less than 50 cents, less than a cup of coffee, and can save the lives of hundreds of thousands of children and mothers, and we're not getting them out to those in need. So what we set out to do as our group is to first and foremost mobilize the attention of national and global leaders to pursue the relatively basic solutions, fixing the distribution systems to get the medicines to children and mothers, building the awareness and the education of health providers to effectively provide them, and then building the awareness of the mothers themselves.
Based on this week's meeting, the Commission will present their final recommendations later this year, in hopes to not only tackle treatable diseases, but prevent 33 million unintended pregnancies, protect 120 million children from pneumonia, and ultimately help save a total of 16 million lives.
Good. Well, we are just about out of time. I hope you will join me in applauding our panelists not only for saying so much, but for saying it in so little time. And we see the balance of 2 minutes and something to speed up the rest of the afternoon. Thank you very much.